Well, thank you, Mayor and Paul, for your leadership, and being here today is not a it's certainly reinforcing the fact that we have an all-in strategy here in the state, and it includes our municipal leaders along with our state government. So I know that beginning on January 5th right here, you'll start running every Wednesday night at the Mount Senior Gattery School with a vaccination clinic for help the people in Woonsocket, North Smithfield, and nearby communities. So very important for us, and I want to thank the fire department, both in Woonsocket and North Smithfield, who will be stepping up to reactivate the clinic, get the shots in the arms, make it as convenient as possible, and that's our goal, is to create convenience. And we know that on a local level, I think that both the mayor and the town administrator would both agree that their residents in that community will respond to a local opportunity in terms of both vaccination and testing in a way that will resonate around the state of Rhode Island if we're able to duplicate that in all 39 cities and towns. So we know that North Smithfield and Woonsocket are just 2 of the 20 communities so far that are now, after we met with them last week, the municipal leaders that are going to step up, not only on clinics for vaccination, but also many of those have also indicated that they want to participate in the effort on the testing issues, which are challenging for us for many reasons. But I would just say that local government is really a key factor in our efforts in terms of addressing the current surge that we're having in terms of infection rates. And we want to make sure that we contain the issues relative to our hospitalization rates. And I believe that we're on a path to do just that with everybody getting on board with the effort. So we know that, as the town administrator said, that we've come a long way since the time I became governor, sworn in as governor, in terms of our vaccination rates. And it has a lot to do with everyone, whether it's DOH, FEMA, our National Guard, and along with our municipal leaders and all the pharmacies, the CVS's, the Walgreens. They've had a great deal to do with it. As I mentioned a few weeks back, we were actually kind of like ramping down this issue with the COVID prior to Thanksgiving, and now we're ramping it back up. When I became governor, Rhode Island had the best testing in the country. And it continues to have the best testing in the country. But when you start talking about the amount of testing that's going on, over 20,000 tests in a day, we're in the process now of being able to absorb that in a way that not only will we get the results back in a more timely fashion, but also we're going to gear up in every community in the state to make sure that that we have the capacity and we can cut down some of the waiting lines that we know are there. So I would just say that this morning we had another meeting with the municipal leaders and directed that. Yesterday I was in Central Falls with Mayor Rivera. What I saw there was that we needed to do a great deal better in terms of the customer service, the way that it was structured. I think that we're getting that done today. I think that in a way that is going to really important and is going to resonate as we continue to touch base with all our municipal leaders in the state of Rhode Island. And I want to thank our municipal leaders for stepping up. Their partnership has and will continue to be crucial for our COVID-19 response. While we're on the topic of the municipalities, as I just shared, what I saw in Central Falls was that we can do a lot better yesterday. Long waiting lines, not differentiating between people who had appointments and not having appointments, and an indoor strategy that is actually going to make it more convenient, not only for the people in Central Falls, but also it's a good lesson for us to respond to around the state. So I thank Mayor Rivera for her leadership and her vocal advocacy for Central Falls, and I expect the same thing from Mayor Baldelli Hunt, as well as our town administrator as well, from Paul as well. So We've heard from several communities that in addition to doing vaccinations, they have the capacity to do more testing, and that's one of the messages that we're delivering here today. And we'll be working with them, to make sure that that happens in a way that's convenient and it works well for the people who live in the different communities. I can't stress this enough. While we're testing more people daily than at any point during this pandemic, our municipal leaders need to be part of the process to help the capacity issues. They have ideas, and we need to listen to them. And that's why I'm committed to making sure that each and every community is part of this effort, of this all-in government effort, whole government effort, which includes our municipal leaders. Today, I also wanted to help ensure that this happens. I'm announcing that Rhode Island Emergency Management Agency Director Mark Pappas will begin a temporary assignment as a senior advisor and chief COVID administrator in my office. This is something that Dr. Alexander Scott and I talked about last week. We have agreed that a more all-hands-on-deck effort is going to be important, and we're reverting back to during that April, May, June time frame of 2020 to make sure that we're leading and coordinating the whole government COVID response team, working closely with the Department of Health and Rhode and Commerce and DBR and all the municipal leaders and our National Guard, and making it an all-in effort. So Director Pappas will be the dedicated person on our team who is focused entirely on the COVID operations on a temporary special assignment. So I thank Mark for stepping up and adding to our team effort here. And I know Mark, I let Mark know yesterday that one of his first jobs was actually to address the Central Falls testing sites. He and his team and Department of Health, I headed out there again today to work on a solution, and after that, I know next on the list I'll be working with Mayor Lawzer to get more testing capacity in the key neighborhoods in Providence and beyond in all communities. And we made the offer today that all municipal leaders could certainly call on me and our office to make sure that coordination happens as we enter into a time frame that we are going to be challenged. The last thing I'll say about a municipal leader call, I let the mayor, town administrators, managers know that if the Senate does not act on a vote on the Open Meetings Act legislation as they come back into session, that our administration will on the legislation that our administration submitted to the General Assembly last year, that I will act and through executive order to put in place temporarily an open meetings remedy to some of the issues that the municipalities are calling for. So the best outcome would be a more long-term solution done legislatively, as I've said, but we will work to ensure we're responsive if that doesn't happen right away. Last week we said that two of our top priorities were increasing our vaccination capacity and increasing our testing capacity. Today we want to update Rhode Islanders on the progress that has been made, that we've made, and our goals for the next few weeks. I want to start with testing. This week we brought on a new lab which will help improve the PCR test results turnaround times. The lab began processing samples this week, increasing our capacity, and over the next couple weeks we will be adding a third lab to expand the capacity even further. Our goal is to get back to a 48-hour turnaround time on the PCR test. We will continue to open additional sites over the next couple weeks, and I've let our team and at the Department of Health know that we're working together to get this right, and it's crucial that we get the testing right at this point in time. I also want to announce that I've directed our team to get state testing sites open on New Year's Day. There's no reason these sites should be closed during the holidays, especially at this point in time when we're creating a great deal of urgency in terms of responding to the pandemic and the place it's at right now. We anticipate having several thousand appointments come online later this week to help increase the access after the New Year's Eve. On vaccinations, in addition to testing, we're also making progress on expanding our capacity to get shots in the arms, especially booster shots. I've already mentioned the 20 cities and towns that will be reactivating local vaccination clinics to help expand our capacity and making getting a booster much more convenient. Our team is continuing to work closely with cities and towns to provide more vaccination and testing opportunities in all 39 cities and towns. On top of that, I am announcing that we will be reopening a mass vaccination site at the Rhode Island Convention Center as soon as the week of January 10th. Both testing and vaccination will be available at this site. And I want to thank our team at the Rhode Island National Guard, who we've relied on so much over the last 2 years. And we're back knocking on their door, asking for help, and they're mobilizing as we speak to help stand up and operate these vaccination sites. Hospital staffing. We are continuing to work closely with our local hospital leadership on strategies to address their long-standing staffing issues, which have been amplified by the COVID-19. We're working to respond to requests that the hospital put in front of us. That's exactly why I put in place mitigation measures like masking and proofs of vaccination last week, a few weeks ago. Last week, at the hospital's request, I issued an executive order that would provide liability protection. We did this because hospitals communicated that the threat of lawsuits is contributing to the staffing crisis and can hinder recruitment and constrain medical professional judgment and limit hospitals' flexibility to adjust medical staff to patient ratios. And we changed our policy to ensure that if someone has a valid license in another state and wants to come and work in a hospital in Rhode Island, we will grant a temporary license right away. As recently as yesterday afternoon, I had a meeting with hospital leadership, representatives from the federal delegation, and our whole government response team to discuss staffing. The National Guard was part of that call yesterday, and I spoke with General Callahan this morning, and his team is having a follow-up discussions directly with the hospitals to get from them the specific job categories that they need to support with. And I want to thank again the Guard and General Callahan for their continuing efforts to explore how to make this work effectively for the hospitals and their needs. Just before coming today, I spoke with Labor Secretary Marty Walsh about another serious issue raised to us by the hospital's leadership when it comes to the extremely high cost being charged by companies who are sending traveling nurses to our state. On that call, Landmark was on there, and we talked about a specific example of how this is working against us. The very nature of the project was to help staff up hospitals, but what the reality is that it's costing an inordinate amount of dollars on the staffing. And what's happening is, for instance, we had a nurse in one of the hospitals sign off on their shift, and the next day they got a call from the traveling nurse management team, that they could supply a nurse to that very hospital the next day. It went from $45 an hour to $195 in one day. And when you multiply that over and over and over again, this is putting an exorbitant amount of pressure on the finances in the hospitals. So we've been working with the congressional delegation. I've had conversations. I expect to have another conversation with Secretary Walsh and the Health Secretary on this very issue. This is a national issue, and anybody who thinks that there's an easy solution to this challenge is not paying attention. But I believe that one of the solutions is that we wouldn't allow during an emergency or a crisis gouging on gasoline prices, gouging on milk prices. So why would we allow this gouging that's going on right now in terms of workers? CDC guidance preview back to school. Just a minute, I'm going to turn it over to Dr. Nicole Alexander-Scott to provide an update on new quarantine and isolation guidance from the CDC and what that means for Rhode Island. Right now, we know that back to school is a top of mind for many students, family, teachers, and school staff. Together with the Department of Education and Department of Health, we have come up with a way to safely bring our students back to school in person learning, just as we did at the start of the school year. Yesterday I had a comprehensive meeting with not only the Rhode, Department of Health, the superintendent representation, school committee representation, the AFT and the NEA, and our office to discuss this very issue about reopening our schools. From our experience and based on the data, we know that schools are one of the safest places for students to be. That's why we are confident in saying that schools are expected to return in-person learning after the break to limit further disruption in the learning process. The state has been working hard to expand access to vaccination and testing to keep students in class where they can benefit from the academic and social emotional supports of in-person learning. While there are no plans for the statewide distance learning, some districts may take a phased approach for their return to allow for testing, and I will go over that in a moment. Districts will determine what works best for them and should be communicating their plans with their families in preparation. Our layered mitigation approach, which consists of vaccinations, masking in schools, testing, distancing, and ventilation, has helped us ensure safety in our schools. And based on the recommendations of the CDC and the data we have, we are making some revisions to policies for schools to help keep students in class. Rhode will be communicating with the district leaders directly on these changes and sharing that info in a press release. And we'll speak to that today with Victor Capian. We'll address some of these issues as well. To highlight some of the updates, these policies, students who test positive and show no symptoms or whose symptoms start to go away can now leave their house after 5 days. They may return to school on day 6 with no symptoms and follow mitigation strategies like masking and other precautions that we have set in our schools. This is a shorter isolation period, meaning students can return to school sooner. And we will continue with that approach and closely monitor the situation and adjust as needed. COVID has presented us with a wide-ranging challenges, and we've had to adapt, but the priority is keeping students in the classrooms where they can learn best. I want to thank our students, families, teachers, and support staff for their continued collaboration, along with those who met with me yesterday, as I just described, to address a common strategy that we can rally behind to make sure that our students are safely in the classroom along with our teachers and staff. To address specifically Providence return to school plan, the districts weighed several factors. With safety in mind and out of an abundance of caution, the 21,000 students in the districts at Providence Public Schools district made the decision of having a staggered return to school for pre-K to grade 12 students beginning Monday, January 3rd, 2022. This phased-in approach will allow districts to conduct testing as students return to prevent potential exposures. Those who are not in person will be expected to participate in distance learning to minimize the disruption of the learning. The district has been preparing for this. Heading into the peak, Providence Public Schools had a series of community events where they vaccinated over 400 people, provided over 1,000 home tests, and distributed 50,000 meals. We recognize that testing is the key, so Providence Public School will be hosting COVID-19 testing clinics for the Providence School students and their families for this upcoming Sunday, January 2nd, 9 a.m. to 12 noon at the Providence Career Technical Academy located at 41 Fricker Street. I would just say to the other families in the state of Rhode Island, just check with your local districts. I know that they are planning on doing testing strategies leading up to the opening of school, and I would refer you to the local districts on that. All right, so we have Victor Capian, who will, from the Rhode Island Department of Education here today to answer any further questions about the return to school. I also want to take a moment, big shout out for the Dunk last night. They had a big game last night. I was watching some of that on TV, and the mask wearing looked very good, and that was a big effort for demonstrate the need and the cooperation from the people in the state of Rhode Island. Our team connected with the Dunk today and heard feedback that overall things went very smoothly, and I want to thank the staff at the Dunk, all the players, spectators for stepping up and doing the right thing, and also way to go PC on a big win. I don't know if you followed last night, but PC is 21st ranked in the country, and they defeated the 15th ranked team in the country, Seton Hall, last night. So that was really good, and then we were able to have people there to cheer them on. So I thank the people that were there wearing the masks where other states and other professional teams are canceling events. If we do things right, we can keep those events going. And that's not only important to our universities, but our economy as well. So thank you for showing up and wearing a mask and cheering on the Friars. I certainly plan to do that before the season's end, both at the Ryan Center and at the Dunk, cheering on our home state teams. And I've got an invitation to go to the other universities too, and I'm going to try to make that happen. So that was a lot of information, and there's a lot of work going on. And I want to thank you for those who are listening in, sticking along with all that information.